Assalamualaikum and hello everyone. My name is Nabila Nurmashara binti Ismail. I'm a university student and I'm your moderator for today's forum. The title for our forum today is we're gonna discuss about the nutritional issues that related to the one vulnerable group, which is geriatric patients. So the topics for today's forum is malnutrition among geriatrics. Before we start our forum, let me introduce you our panelists for today. First, this is Dr. Anis Farhana, a geriatric doctor. Second, Ms. Udaimatun Noor, a nutritionist. And lastly, Ms. Camelia Arfina, a care manager at Geriatric Hospital. Without further ado, allow me to start the discussions with the first question for Dr. Anis Farhana. Doctor, can you explain what is the common health problem for the geriatric patients? And is there any side effect of the health problem to them?
Hi, Assalamualaikum. Thank you, moderators, for the question. So, according to CDC, 41% of persons aged 65 and above are reported being high and excellent condition in 2017. This is encouraging news given that average life expectancy is increasing with many 65 years old to 80 years old can live happily. So seniors are frequently confronted with a number of health issues that might have impact in their later life. So these are some of most common issues the elderly people experience, which we may not know that already affected them, or uh, they are in early stages of our parents and grandparents. So certain medical disorders are influenced by our family history, age, their past lifestyle. So, however, by making it a sensible, healthy choice of lifestyle, contact a doctor regularly can be avoided the progression of or slow down the problem. What I'm going to tell you is the most typical health issue that happen among elderly. So, firstly is cognitive decline. While memory loss is typical as people get older, Alzheimer's disease is not. It is critical to notice the early stages of Alzheimer's disease. Since early intervention and treatment can help limit the illness progression. So oral health issue was the second health problem. Although not all the seniors losing their teeth, it can be the problem of bacterial illness that affects the gum and bones that support the teeth. So frequent visiting the dentist for cleaning every 6 months will keep their teeth and gum in a good shape. Heart diseases. For those are almost over 65 years old, heart disease is still the leading cause of death. High blood pressure and cholesterol must be appropriately handled, and taking care of their heart is essential to avoid developing heart disease in later life. Osteoporosis. According to the National Osteoporosis Foundation, approximately 54 million persons over 50 have reduced bone mass or osteoporosis. This is kind of worrying us that nearly all adults over 18 have arthritis in some form. Regular exercise and healthy diet might help to protect them, their bones especially, and joints. Next is pneumonia or flu. Infections such as flu are unparticular among elderly. However, this recent years COVID-19 has been around us and seems to be evolving to be more dangerous virus. Seniors in particular are more susceptible to them. And due to reduced immune system, they may be less likely to recover successfully. So remind your parents or grandparents to take a vaccine and not go out regularly. Only go out when it's important things. So vision and hearing loss. Millions of elderly people suffer from age-related eye problems such as macular degeneration, cataracts, glaucoma, and 42% of those with hearing loss are 65 and older. Moreover, is respiratory disease. If your parents already have asthma or chronic obstructive pulmonary disease, or we call COPD, might become worse as they get older. So next is diabetes. This is the most common disease among younger or among old elderly. So type 2 diabetes affect around 1/4 of person aged 65 and above. The sooner you recognize that your parents are at risk or having that diabetes, the sooner you can start controlling their blood sugar and implementing lifestyle changes that will help you to do so. Lastly is the most common health problem, which is cancer. Women, for example, are more likely to develop cervical or endometrial cancers, whereas men are more likely to develop prostate cancer. While it may not be feasible to completely avoid cancer, but tests to discover certain tumors in early stages of their life can aid in their effective treatment. Thank you. Again, thank you, Ms. Moderator, for the question of side effect of the health problem. So as people get older, especially with common diseases, they tend to develop a number of complex health conditions known as geriatric syndrome. Frailty, sleep problems, urine incontinence, falls, delirium, pressure ulcer as commonly a result of numerous underlying causes.
Such a clear explanation, Doctor. Thank you. Next, I would like to ask Ms. Uday. Ms. Uday, as we listen to Dr. Anis, we know that malnutrition is one of the side effects of your health problem. Can you tell us, is there any consequence of the malnutrition? Will it be good or worse to the geriatric patient?
Okay, thank you, the moderator, Nabila Nur Mashara. Okay, so first of all, one of the most pressing issues arising from this demographic transition is malnutrition among the elderly. So often, as people get older, their nutrition objective change toward meeting and limiting increased nutrients demand with less energy requirement, as well as avoiding lean muscle loss. So, because of its impact on the elderly, malnutrition has joined the ranks of the geriatric giants, with standing among classic geriatric disorders such as immobility, instability, incontinence, and cognitive impairment. So, these are the common consequences of malnutrition among the geriatric patients, which are protein energy malnutrition, sarcopenia, and cachexia. Other than that, impaired immune status and muscular mass loss, which contribute significantly to the increased morbidity also associated with malnutrition. So, sarcopenia, which is known as reduced muscle mass and strength, contribute to poor physical status, loss of independence, and an increased risk of falls and subsequent fractures, all of which have a detrimental influence on quality of life in the geriatric and the sick.
Okay, Miss. So the next question is for Miss Uday too. Is there any suggestions of how we can tolerate with malnutrition, or how we can prevent the malnutrition among the geriatric patient?
Okay, thank you, moderator, for the thoughtful question. So, first of all, geriatric patients, usually we have a problem with their appetite that directly results in malnutrition. So, to prevent this problem, first of all, the caretaker has to play a huge role. First, encourage them, the geriatric patients, to choose healthier food. Second, to get extra nutrients and calories make them to practice snacking on healthy food between meals. Next, encourage them to do exercise, even a little one, because exercise can help them to improve their appetite and keep their muscles and bones strong. Lastly, consider adding supplement to their diet. This may be benefit them as their food intake was insufficient, which results less nutrients provided for their daily needs. But you need to get a prescription from the doctor first. Thank you.
Alright, thank you Ms. Uday for such a brilliant suggestions and explanation. Alright, now I would like to ask Ms. Camilla. Can we know how the caretaker cope with the patients, how they handle the patients in this case? Is there any special care management procedure for them?
Assalamualaikum and thank you moderator for the questions. I'm going to explain on management and consideration for the development of geriatric foods for caretakers. As we know that geriatric people are people with conditions that limit their capacity to perform daily activities and everyday tasks. So it is important for the caretakers or caregivers to help them to improve their daily activities and to perform everyday tasks. One of the most important role for the caretakers is to ensure that the geriatric nutritional needs are met. Firstly, the caretakers or caregivers must understand how they will serve foods to geriatrics. As we know, elderly are lower in appetite, so they feel they are unable to eat much food as much as required to them. So, to overcome that, the caregivers or caretakers must be creative to prepare or serve food for the geriatrics to ensure they are satisfied with the food and eat everything. Start serving foods in small portions because it is easier for the elderly to finish the foods. Next is serve the foods that suits their local taste and has diversity in color, size, texture to make the foods more interesting. And to enhance the flavor, add natural seasoning or herbs into the foods. It is important to choose nutrient-rich foods, such as all food groups represented in the food pyramids of Malaysia. Foods rich in calcium, such as milk, tofu, green leafy vegetables. Foods rich in iron, such as beef, lamb, mustard. Foods rich in zinc also important for the elderly, such as fish, whole grain products, and most importantly, some varieties of vegetables and fruit. It is important to know that what the geriatrics likes to eat and doesn't like to eat. So it is required to ask them about the food provided or given and try to improve according to the feedback received. And for the geriatrics who doesn't speak or refuse to talk, please record what they are consumed and what they didn't consume. Milk, biscuits, breads, and cereals should always be available for the elderly who refuse to eat regular food. But to keep them from eating all the foods at once, don't give or serve them in big packets. For the elderly who have a problem in chewing, wearing dentures, or have a problem in breathing, it is important to serve soft foods. Boiling, steaming, or some of the cooking process may be used to serve the soft foods. Make rice porridge, beans porridge, or corn porridge. As a snack, make puddings or agar-agar with milk to make them easier to chew. Fruits and vegetables with seeds or hard skins should be removed. Food must be ground using a grinder or mashed with a fork for the elderly who are unable to chew directly. This is general recommendations and eating management for geriatrics. For geriatrics with a specific disease like hypertension, osteoporosis, and many more, It is important for the caretakers to provide the special care and attention to their food intake and management according to their conditions. And that's all. Thank you.
Alright, thank you, Miss Camelia. So that's the last question for our today's forum. I hope everyone get a lot of information about the care of the geriatrics involved with their nutrition. With that, I will wrap up this forum here. Thank you everyone. Bye. Assalamualaikum.